Hello.
Hello.
Yes, sir. Sir, Nomita this side, sir, from Clirnet.
Okay.
Yes, sir. Sir, actually, we have a session from 8 to 8:30, sir. So
Yeah,
are
yeah.
we good to go now, sir?
Yeah, sure.
Okay, sir. Thank you so much, sir. So I'm starting today's session. All of you. Hello and welcome to all. This is Momita, as a moderator from Clirnet. I wholeheartedly welcome all the delegates across the country. We are fortunate enough to get supported by the doctors, and thank you all the doctors for taking the time and join us today. I would like to take a minute to introduce our platform, Clirnet. Clirnet is one of the largest live digital streaming platforms in India where doctors can generate their medical content. So now I am taking this opportunity to welcome to this master doctor, the eminent speaker, Dr. Rajatsubhra Mukhopadhyay, sir. Sir has done ABBS, DCH, AMD in child, PGPN, trained in asthma and allergy from UK, and Director Child Health Care, Arambagh, Hubli. So once again, I welcome all of you to this lecture for the topic approach to a child throat. So before starting the session, I would like to give a brief about today's topic. A systematic approach, sir. Am I audible, sir?
Yeah, yeah.
Okay, so I'm continuing. Systematic approach is employed when evaluating a child with a sore throat. Consideration is given to factors such as fever, cough, and difficulty in swallowing while assessing the patient's history. A physical examination is carried out with focus on the throat and nearby lymph nodes to identify potential causes such as bacterial or viral infections. So without much delay, sir, I would like to hand over the session to you. Kindly proceed with your talk. Over to you, sir. Thank you so much to all of you.
Okay. Thank you. Good evening to everybody. Today our topic is sore throat in child. This is very, very common in our day-to-day practice and very easy topic. Still, as a pediatrician, I will highlight in particular some points later on. But as our routine process, first I will start with the definition. What is sore throat? Sore throat is a clinical state of child and in adult also with irritation and pain of throat suddenly appear associated with or without hoarseness of voice and dry cough and fever. The causes. Causes are mostly pathological, but maybe some non-pathological cause also be the factor. Number one, if there is high-pitched voice abuse, very in louder voice speaking for a prolonged time, or ingestion of some corrosive agent like acid, like any alkali content mixture, like bathroom washing liquid or some floor washing liquid that contains acid, that can cause irritation of the throat and sore throat. This is non-pathological. Among the pathological etiologies, viral and most common. Apart from that, if the patient is more than 3 years of age, the streptococcal cause will come in first category, and in some cases, in children also, the candidal infection, that is fungal infection, may be the cause. Among the viruses, we find, particularly in the autumn and spring season, the influenza. Recently, the overwhelming outbreak of corona, COVID virus, that is also a sort of influenza, swine flu, adenovirus, rhinovirus, that is running nose, usually if I come across with this thing, and some other virus also responsible, but these are most common. And there are typical findings in different viruses. We even in measles, even with German measles, like rubella, even with mumps, with roseola, in everywhere, in infectious mononucleosis, Epstein-Barr virus, and everywhere, there is a common finding of suture. So, if clinically we examine the patient, what we will get? We can find the fever, we can find fine miliary rashes, if it is bacterial, particularly enlarged tonsil. There may be redness of eyes if there is pharyngoconjunctival fever with from the adenovirus, redness of conjunctiva, that is conjunctivitis, with fever, sore throat, and tonsillitis, pharyngitis. Therefore, the pharyngoconjunctival fever, this name is in this way. And if there is infectious mononucleosis from the Epstein-Barr virus, there may be generalized lymphadenopathy, strawberry tongue, and temperature, unexplained temperature more than 5 days with sore throat. In mumps, the glands, the salivary glands will be enlarged, single or both-sided, particularly in parotid area, sometimes submandibular, maxillary area also affected. In measles, there a typical distribution of the rashes, and typical there is variation of the course of the disease. And in roseola, after the fever, the rash appears. In German measles, there may be oblique spots on the hard palate. So these are several different findings that we get in sore throat, and sometimes the white patch from the streptococcal infection, sometimes follicular tonsillitis we get from the associated with the sore throat. Apart from that, there is one condition which is we call the tonsillectomy. It's abdominal pain from the sore throat. The baby is coming with the abdominal pain, but we take definition, we can find that is the sore throat. So from the enlarged tonsils, the pain is referring to the glossopharyngeal and vagus nerve, which is referred pain, that is we call the tonsillectomy. And some other rare findings, but very, very important that we also keep in mind from this sore throat. If it is, it may be retropharyngeal abscess, pharyngeal abscess. There may be some tongue ulcer. There may be some tongue ulcer in some cases. Stomatitis may be there in some reactive cases, and some recurring sore throat cases. We have to think about the asthma. There may be ear acute otitis media association. There may be association of generalized lymphadenopathy. There may be associated with the joint pain because the inlet complication from the sore throat, the acute rheumatic fever can appear. And in sometimes the nephrotic symptoms, though in streptococcal origin, the skin infection, the particular substrain of the streptococcus causing the skin infection are responsible for the nephrotic syndrome. But in sore throat also, even in this case, we also keep it in mind. And sometimes from that, a pneumonia can appear. It can track down to the lower respiratory tract. So we have to think about that cause also. So from the upper respiratory tract, starting from mastocytitis to acute otitis media, the sinusitis to the lower respiratory tract up to the pneumonitis. Everything can occur from the bacterial spreading. But in viral, typically this is minimized, and particularly the course is up from the 7 days to 10 days. So, and it is mostly found in case of children. So, in clinic, this is the clinical finding. In clinical examination, this rash, abscess, neck glands, we have to check the tongue, we have to check the joint. In late complications, we have to see if there is recurrent sore throat, but sometimes we have to counsel the parents about this nephrotic syndrome, about this rheumatic fever, and PANDA. The PANDA, the post-streptococcal neurological symptoms, the sudden abnormal behavior, sudden the neurological problem can appear to the child, is we call PANDA. This is can happen from the immunological reactions of this sore throat. So this is another important thing. So among investigation, how we will proceed, we have to do one TCD-CSA or complete blood count. To see the extent of the inflammation, we can ask for one CRP. And if we want to differentiate whether this is viral or this is bacterial, we have to do one sore throat swab culture, swab test. And if it is recurrent also, it is not healing with the normal course of antibiotic, we have to do that test. And if we think that there is with associated respiratory infections and there is a chance of asthma, we have to do some other tests like lung function test if the patient is older, and one chest X-ray if we see that pneumonia, we suspect that pneumonia is there. And regarding the treatment mostly symptomatic. We have to give the paracetamol analgesics. We have to give some anesthetic agents to minimize the sore throat. Some cooling agents are also there. If there is tongue ulcer, the topical agents. If ear throat, you have to treat accordingly. And then it comes, if you think it is bacterial, or if you want to prevent from the secondary bacterial infection, we have to add one antibiotic. And antibiotic course usually now it is recommended from 6 days to 10 days. Particularly it is up to 10 days, and the first line of choice is amoxicillin clavulanic acid or ceftriaxone chlorophyll and azithromycin. But in the older antibiotics like penicillins and amoxicillin, we can try the amoxicillin. But as there is a chance of rashes in some diseases, and also there is a chance of rashes along with the amoxicillin treatment, usually in clinical practice, it's better to be avoided. And I think the ceftriaxone group or the azithromycin are the better choice. So if it is not healing with this normal course of therapy, then we have to go in second generation of cephalosporin, third generation of cephalosporin, or some other add-on drug. But this is very rare. Practically, we face it in very rare cause. So this is in nutshell. There are some uncommon condition also, like if there is ingestion of corrosive agents. And we have to keep in mind, when we have to, being one parents, we have to visit one doctor. There are some particular symptoms like high fever. If this patient looks dehydrated, looks drowsy, if drooling is there, nothing is the patient baby is not taking. Because if the baby doesn't take anything, we have to advise the sips of water and the ORS powder, fruit juices. Even he doesn't take anything in mouth, still with shifts, and by beat we have to keep him. If it is not possible, we have to visit one doctor, visit to us. We have these parents have to visit to our chamber. We have to then, after checking the patient, examining the patient and the condition of the throat, if the condition is severe, like this corrosion, ingestion, the burning within the site, we have to admit the patient and start one intravenous drip and intravenous antibiotic accordingly. So this is in nutshell all about the sore throat. Now I am handing over the patient, the telephone to the moderator, and I will wait for some questions if you have. So please, moderator.
Okay. So the first question we have received from Dr. Vidyut. Sir is asking, how do you ensure continuity of care and patient education regarding recurrences or prevention?
Regarding the recurrences first, we have to counsel the parents to come back. If sore throat again comes within 1 month or within 2 months with some other symptoms other than sore throat, upper respiratory tract symptoms. Like if there is not, in that time within 2 months there is not directly sore throat, but there is earache, there is sinusitis like presentation, that headache, then the parent must have to come back to the doctor, and doctor have to think in the line of recurrence, why the infection is coming back. If there is some faulty administration technique of the antibiotic, if the antibiotic is resistant to the positive organism, because if there is recurrence, mostly it is not viral, because virus usually do not come back within a short course of time. There is a period of immunogenicity. So it is, if there is recurrent, we have to think about the atopic nature of the patient and or bacterial resistant to the antibiotic. So in that way, we have to think and we have to counsel the parents. If there is recurrence, they will come back, and within investigation we have to do one sort of culture. Already everything I have discussed in my earlier discussion, and we have to treat accordingly, according to the culture and sensitivity report. And for the recurrence, we have to keep it in mind about the atopic nature, and we have to rule out the causative agents and treat accordingly. So regarding prevention, one is the appropriate choice of the antibiotic, the prevention, and ruling out the allergen agent from the atopic section, and the vaccination, proper vaccination. Now in government schedule, it is mostly covered with within vaccine in government schedule. But if sometimes the parents want to take it in privately or some special other vaccination, regarding the sore throat, there is no such vaccine that is not covering the government of India nowadays, except there are some special vaccines like meningitis, meningeal vaccine, and some pneumococcal strain, but these are not the causative agent of this sore throat. Starting from the mumps, measles, rubella, Haemophilus influenzae, everything is covered by government vaccine schedule. So, for administration of this, we have to check about that whether proper administration of the vaccine is given or not. Thank you.
Thank you so very much, sir, for answering this question. So, sir, now I am moving to the next question of today's session by Dr. Poonam Thakur. So, ma'am is asking what strategies are effective for relieving pain and discomfort in children with sore throat.
First, already this part also already I have stated that we have to use some soothing agent. You can advise some ice pole, like long candy with covering with plastic, so small slender plastic ice pole. You can use that for sucking. Number one, you can give honey. You can give anesthetic agents. There are some mouth agents and there are some gargle agents where anesthesia is given, lignocaine is given. You can give that. You can add that thing also. And sometimes if you think that the inflammation is too much, you can add, there are some mouth agents for the tongue ulcer where very, very small dose of steroid is given like triamcinolone acetate, like Kenacort oral paste. Sorry, Kenacort oral paste is there. So if you add that part, that can minimize the inflammation. This is one thing. Another thing is ice cube. Another thing is mouth coating agent. Some anesthetic coating is there, and some lignocaine spray is there that you can use within the throat. That can alleviate the discomfort. And mostly the mothers face a problem during the swallowing, feeding of the baby. This is very important part. Very slowly, very gently, with semi-solid food, with liquid food, with massed food in massed manner, we have to keep. And the ORS or fruit juice, if the baby doesn't allow him to declude that part, then you have to give him or her sip by sip, very slowly. And practically, if it is not at all possible, usually it doesn't happen, but if it is not at all possible, in sometimes, if there is some total obliteration of the passage, then you have to transfer the patient to the hospital for some other assistance like IV fluid, breathing apparatus like that. Next question.
Definitely, sir. How do you balance the need for imaging with concerns about radiation exposure?
Radiation exposure in sore throat, this is very rare. Very rare radiation exposure. Now, first we have to think that this season is mostly for those doctors who are practicing in our whole over the country, and our country is mostly based, 70% is mostly based on rural India, and where the primary care and down to the earth and in day-to-day practice, very clinically you are getting the patient where this radiation exposure chance is very, very minimum, and mostly we get it the viral and during the change of season. But if we get such type of patient, like there are some cases where there is some neoplasm or some malignancy is there, so or inadvertent radiation exposure, anyhow it has happened. In that case, from this setup, our first job, we have to locally first anesthetic agent we have to apply with lignocaine spray like that substance, and then we have to refer the patient to the ENT specialist or to the higher center for the proper management and guidance. And particularly in the counseling part to the parents, we have to just say this thing that this is also manageable condition, but they have to check to the higher center for the selective management. From this area, this radiation exposure management, if the patient is suffering from malignancy or some other conditions, then it is not possible. So this is the first thing. A counsel the parents with assurance, give some local anesthesia for the lowering of the symptoms, discomfort, and send the patient to the higher center. Thank you.
Thank you so much, sir. These are the three questions we have to from today's session, sir. And thank you so much, sir, for answering all the queries of our delegate doctors. And it was really informative and helpful to all the delegates. And thank you once
Thank
again,
you.
sir, for your valuable time and for being with us on our platform and sharing such valuable insights.
You are
And
most welcome.
also, thank you, sir. And I would also like to thank all the participating doctors for your continuous participation at our platform. And finally, I would like to request you all, if you have any other topic based on the specialty, so just let us know and we will be very glad to conduct a session on that particular topic. So now, sir, with all your permission, I'm closing the session here for today and looking forward to hosting you again with a different topic. Thank you.